This is Dr. Imran Khan. I am MD General Medicine. I am a consultant physician in Care Mushirabad. Today I just want to talk regarding obesity. See, obesity, I think everyone will be familiar with the name obesity, but we are not familiar with the problem situation about the obesity. See, obesity is a chronic disease. We can say in other words, it's the mother of all lifestyle diseases. So when we will say the person is obese, how to diagnose the obesity? Simple formula is there. We call it as a body mass index, BMI. You take the height of the patient and weight of the patient. Weight in kg divided by height in meter square. This will give you the BMI. Just simplify that. You can Google it out and see, and just type BMI and put your height and weight formula in the Google. You will get your BMI. So the normal BMI should be less than 23. So whenever the patient is having BMI more than 25, we will catch as obese. And when the patient is having BMI between 23 to 24.9, we will call it as a overweight. In Indian scenario, in Western world, you can see the parameters or the values are different. Like in Western world, we'll say the obesity as when the BMI is more than 30, right? So it's very easy to diagnose whether you are obese or not. I think many people around us will not be knowing that they are obese or overweight. So first thing, after seeing this video, you should go back to this formula with BMI and calculate your BMI and see whether you are obese or not. Right. So why we are discussing about this obesity today? So importance of obesity is, it is, as already I have said, it is a mother of all lifestyle diseases. So when the person is obese, he will have all kind of disorders one by one, or some patient will have disorder particular to the one organ system, some patient will have disorder to the other organ system. Like if you see the cardiovascular system, heart, so patients are very prone or high risk for developing coronary artery disease. In simple words, patient may have heart attacks. In the same heart, patient may have possibility of pulmonary embolism. Patient are very high chances of developing varicose veins. Patients are very high chance of having stroke, or we can, in simple word, we will say as a paralysis. If you see toward the gastrointestinal system or GI system in the abdomen, these obese patients are very high risk for getting stone in the gallbladder. Gallbladder is a pouch below the liver. So chances of having stones in the gallbladder are very high in these obese patients. Also, they will be having high risk of GERD, gastroesophageal reflux disease. Also, this patient will have liver problems like non-alcoholic fatty liver. So there will be deposition of fat in the liver, and chances of developing further damage to the liver are high in this patient with non-alcoholic fatty liver. And also these patients are prone to the different kind of carcinomas in the GI tract. Coming to the other systems like metabolic disorders, these patients are very prone to develop diabetes. You know, the diabetes is a leading cause of mortality and morbidity in India and worldwide. So these patients are also very prone to have diabetes. Then high cholesterol levels are also seen in these patients with the obesity. So there is an endless list of medical disorder which are secondary to the obesity. That's why we need to have a society where we are having a very less number of obese patients, or we are free from the obesity. So first important step is you need to diagnose yourself whether you are obese or not. This is the thing. Second, once the diagnosis is confirmed that you are obese, now what to do next, right? In this case, you can consult a general physician. He will help you in the treatment of the obesity. First of all, we need to find out what is the cause of your obesity. The most important thing in our Indian scenario is our lifestyle, like we are having a very sedentary lifestyle nowadays, and overeating. This is a very important thing which causes obesity. Overeating. In Indian scenario, Indian people, we want satisfaction from the food, like we want to fill the stomach full. So that's when the fullness of the stomach comes, then we'll stop the eating. This leads to the overeating and finally leads to the obesity. And second is the sedentary lifestyle, like nowadays living in a very kind of comfortable society. We don't want to go by walking to anywhere. We use vehicle for everywhere. So we don't want to use the staircase. We want to use the lifts always. So this has increased the risk of developing obesity in our life. This is the first cause. There are certain medical disorders or certain drugs which can lead to the obesity, like hypothyroidism. So the patient will have increased weight and other symptoms of hypothyroidism. So we need to evaluate whether the patient is suffering from hypothyroidism or not in case of obesity. Second medical disorder is like Cushing syndrome. This is also one of the cause, not very common, but it's also a contributing factor in the obesity. Third, like PCOS, polycystic ovarian syndrome. So this is also linked to the obesity. Then there are certain genetic disorders which are linked to the obesity. These are the things we need to find out in the patients having obesity, whether this is happening due to just lifestyle changes or some underlying medical disorder is there. If certain medical disorder is there, we need to address his treatment. This is the thing. Then there are certain investigation which needs to be done in the obesity, like blood sugar, then fasting lipid profile, then TSH or thyroid function test. Then in certain cases, if certain features of Cushing syndrome are there, then 24-hour urinary free cortisol level needs to be seen in the obesity. These are the investigation that to be done in the obesity. Then what about how to treat it? There are three things in the treatment. First is lifestyle modification. Second is your medication or drugs. Third is surgery. So first of all, in the lifestyle changes, there are three components. One is diet. Second is your increase in the physical activity. And third is your behavioral changes. For coming to the diet, in the diet we need to give a low calorie diet to the patient. Low calorie, what is the low calorie? How to find out the calories and how to say it's a low calorie or this thing. To simplify this thing, whatever the patient is taking, give him 500 to 1000 kilocalories deficit diet. For example, the patient is eating in the lunch like 4 chapatis. We'll reduce it to the 2.5 or 3 chapatis. So systemically, we'll whatever the patient is taking, will reduce the calories by 500 to 1000 kilocalories in a day, and we'll monitor the weight. This is one thing. Then in the diet, you ask the patient to increase vegetables, fruits, fiber containing food in the diet, and also ask the patient to decrease intake of fried items, oils, and certain beverages which contain high sugar, like carbonated drinks or certain juices with very high sugar. So these are the diet modification which what we can do to treat the obesity. And with this diet modification, we'll monitor the weight of the patient. We want to decrease the weight. There is a limit that we want to decrease. Like if you see in a week, we don't want to decrease the weight more than half kg to 1 kg. Maximum you can decrease 1 kg in a week. If we go beyond decrease weight more than 1.5 kg in a week, patients are very prone to develop gallstones. So and which can come into the picture and complication will start. So we need to decrease the weight in a very monitored way. Then coming to the second point, as physical activity, we need to ask the patient to increase the physical activity at least 150 minutes in a week. That will roughly come around, I think, 20 to 30 minutes activity 5 days in a week. So what kind of activity the patient can do? The activity is like he can do a brisk walking, or slowly he can do a jogging if possible for him, or you can use a treadmill or exercise cycle. This all things can be done. So we need to keep a time like at least 20 to 30 minutes in a day should be done, whether in the morning or evening, whenever the patient gets time. That is about the physical activity. And also try to take staircase instead of lifts. Try to go by walking whenever you are feeling, whenever you are getting time. Go to the malls and do shopping instead of purchasing the things on Flipkart or Amazon. These all things are very important to make the patient very active in the life, right? So this is about the physical activity. And third thing is behavioral modification or behavioral therapy. In this thing, we need to keep the patient motivated. The most important failure things in the management of weight is up to certain extent or certain weeks or months, patient will follow the whatever the diet and exercise you have prescribed him. But after some period of time he will not have motivation to do this. So to keep motivated patient, you need to do certain things, like you can ask patient to use pedometer. It is very easily available. Everyone is having smartphone. They can download the app with pedometer, and they can monitor their activity daily, how much steps they are going, how much calories they are burning, how much food they are eating. All this can be monitored, and they can maintain a journal in which everything is written daily, like how much steps you have gone, how much calories you have burned, and also what kind of food you have taken. So this can be maintained in a journal, so that the patient will be motivated throughout the time to decrease weight, and also to maintain that particular target weight for the patient. Right? These are the lifestyle modification or lifestyle advices what we give to the patient. So now, if they failed, if diet, physical activity and lifestyle, this behavioral therapy, if this fails, then next come the drugs. And also when the patient's BMI is more than 30, we can directly switch over to the drugs. So there are two types of drugs which are to be given in the obesity. Like one is the drugs which decreases the appetite, and other is the drugs which decreases the absorption of fat in the stomach or in the gut, right? The first group are like phentermine, then there is topiramate. These are the two drugs, and recently one new drug is also launched. And in the second group, which decreases the fat absorption, is orlistat. They have certain side effects also. Like in the first group, patient will have dry mouth, dizziness, sometimes constipation, sometimes giddiness. All this can happen with these drugs. And in the orlistat group, patient may have oily stools, frequency of the stool may increase, patient may have flatus or flatulence. These all things can happen with these drugs, but usually no major side effects will be there. Then this is the second part of the management, and third part of the management is surgery. When the patient BMI is more than 40, or all these things are failed, and patient is having something very significant comorbidity like obstructive sleep apnea or uncontrolled diabetes, or some kind of what we can say lifestyle disorder, which are not getting treated with the medicines properly. So in this patient we suggest surgery. The surgeries are like one is sleeve gastrectomy, second is ROX NY gastrectomy, gastric bypass, ROX NY gastric bypass. So what they do, they cut the part of the stomach and decrease the size of the stomach. So what happens, when the person takes the food, he feels satiety, but at the same time the absorption of calories will be less in these cases after the surgery. But also definitely with these surgeries, complications are also there, like patient may have infection after surgery, patient may develop anesthesia complication, patient may develop leak over the anastomosis which has done in the operation. These are all the complications. So this is the management, this is the diagnosis, the risk or the complications of the obesity, and your management of the obesity. Thank you.